Hi guys, this is Mamian. I'm a review lecturer for Nle Nclex and let's learn more about your stomach care. The first is, ano ba talaga ang stoma or ostomy? Guys, yung stoma or ostomy, it is an opening of your gastrointestinal tract onto the skin or the abdominal wall. They are also known as bowel diversions kasi nga yung function talaga ng stoma mo or ng ostomy mo is to divert your fecal matter onto the abdominal wall rather than releasing it in your anus. Now, ano-ano ba yung different types of stoma na meron tayo? I'd like to classify them into three types lang, guys. The first one is you have your end stoma or terminal stoma or also known as your single barrel colostomy. This one, usually it's a permanent stoma. Isa lang yung butas na meron siya sa abdominal wall niya. Kaya nga single barrel colostomy ang tawag. Next naman is you have your loop colostomy. This one, from the word itself, loop. You loop out the intestine and ilalabas mo siya sa abdominal wall. In this kind of stoma, guys, you can see two stoma in the person. So, meron siyang two parts. First is you have the proximal or the afferent stoma, which is basically yung attached pa to your small intestine and your upper gastrointestinal tract. Itong proximal or afferent stoma mo, guys, this is the active part. Ito yung part na ina-expect mong magre-release ng stool. While your distal or efferent end naman is the part of the gastrointestinal tract na cut out or disconnected na. Meaning it is the inactive part, the one that releases mucus. Kaya sometimes it's called your mucus fistula. And then lastly, you have your double barrel colostomy. This is when the bowel is divided into two parts and you will also see a proximal or afferent end, which is the active part of the intestine, and the distal or the efferent end, which is the one that releases mucus kasi disconnected na siya from the gastrointestinal tract. Now guys, it's important to note that your loop colostomy and your double barrel colostomy, these are the types of colostomies that we do most of the time during emergency situations, such as bowel obstruction or when there's a part of the bowel that needs to heal. That's why most of the time, your double barrel colostomy and loop colostomies are the temporary kinds of colostomies. And the similar features that they have is that both of them, they have a proximal end or an afferent end, which is the active part, the one that releases stool. And they also have a mucus fistula or the distal end or the efferent end, the one that will release mucus. Ma'am, ba't naman nagre-release ng mucus yung distal end ng mga colostomies na yan? It's because your intestines, guys, even if they no longer are part of your gastrointestinal tract because you cut them in a colostomy, they still produce mucus to lubricate the surrounding tissues or mucosa of that particular colon. So the mucus that they produce gets released in their respective distal ends. And guys, take note, itong distal end ng loop colostomy mo or double barrel colostomy mo, you can have an option of not covering it with a bag, but rather you can cover it with a vaselinized gauze to absorb the mucus discharge or a stomach cap. Note the term, vaselinized gauze ang nilalagay natin. And why is that? It's because a vaselinized gauze can keep moisture in that particular distal end of the stomach, which will promote better healing and will keep moisture in that area. Now let's move on to particular stomach facts that you have to know so that you can answer questions regarding stomach care. Number one is regarding the appearance. Guys, ano ba yung dapat na appearance ng isang stomach? Let's start with the color. Ano ba yung mga normal and expected colors of a colostomy? They should look reddish or brick red or meaty red or fleshy pink. Yan yung mga terms na ginagamit natin. And the consistency of your stoma must be moist. It should not be dry. And why is it moist? Again, just like what I have said, it's because they still produce mucus that lubricates the surrounding mucosal tissue. And what are the things that are normal and expected post-surgery? It is normal to expect slight or scant bleeding when you try and touch your stoma, especially early post-op. What's not normal is if it starts to bleed more than the scant amount. That one is reportable to the physician. And ano pa, it's normal to not feel any sensations on your stoma. It's because yung stoma, guys, or the intestine that we have brought on the abdominal wall do not have any nerve endings. Kaya hindi yan masakit. Number two, about appliance or your stoma bag or your stoma pouch. You have to know na it must fit your stoma. And the size of your stoma bag must be 1/8 larger than your stoma itself, or 3 to 4 millimeters bigger than your stoma. You must resize your stoma appliance or your stoma bag or your stoma pouch after 3 weeks post-op, because that's the time when the inflammation has already reduced. And guys, you must know, a stoma will reach a permanent size and will stop shrinking by the third month post-operative. That's why when you reach the third month, you stop resizing the stoma bag or appliance. And lastly, you must empty your appliance once it's already 1/3 or 1/2 full. Number three, what's the expected output after surgery? To answer questions like this, dapat alam mo kung anong klaseng stoma siya meron. If ang patient mo may ileostomy, the output is expected after 24 to 48 hours post-surgery. Pag colostomy naman yan, guys, the output is expected after 3 to 4 days post-op pa. So, if there's no output after 1 to 2 days of the creation of your colostomy, that's normal and expected. Number four, what's the consistency of the output that we expect from different types of stoma? Pag may ileostomy ka, you expect a liquid effluent. And what's important to know about an ileostomy, guys, the discharge or the flow of that liquid effluent is constant. It does not stop. It cannot be regulated. You cannot establish regular bowel habits when you have an ileostomy. And it's important to note na kapag may ileostomy ka, skincare is so important. Why is that? It's because, guys, ileostomy comes from the small intestine, ileum, the third segment of the small intestine. And what do we know about your small intestine? Meron diyang sobrang daming digestive enzymes. You expect that part of the liquid effluent are digestive enzymes. And these digestive enzymes, they have the potential to irritate the skin surrounding the stomach. And if you don't prevent that, you can experience skin excoriation or skin breakdown. So it's important to note that you have to wear your bag or your appliance continuously when you have an ileostomy, and you have to apply skin barrier around the stoma site to protect the skin from skin breakdown from the digestive enzymes being released by your ileostomy. Next naman, if you have a colostomy, it depends what kind of colostomy you have to determine what kind of stool you will expect. So, pag nasa ascending colon or may ascending colostomy ka, you will expect liquid stool. Kapag naman nasa transverse colon ka, you will expect mushy stool. Kapag naman meron kang descending colostomy, sa descending colon siya located, meron kang semi-formed stool or semi-solid stool. And lastly naman, pag nasa sigmoid colon or meron kang sigmoidostomy, you will expect a formed or solid stool. Mukha na talaga siyang tae. And guys, take note, pag ikaw ay may sigmoidostomy, this is the kind of stoma that will allow you to have regular bowel habits. You can regulate your stool output in a sigmoidostomy. And how do you regulate the bowel movement in a sigmoidostomy? It's when you're able to establish routine irrigation. And what's important to note if may sigmoidostomy ka, guys, is early post-op, the discharge will not be solid or will not be formed. In early post-op, in a sigmoidostomy, you will expect to have stool that is semi-formed or pasty. Note the term, early post-op yan siya. Meron kang semi-formed or pasty stool in a sigmoidostomy, contrary to what we said kanina na solid or formed stool. And why is that? It's because, again, early post-op pa to. Early post-op where the bowels are still adjusting to a new colostomy. Eventually, guys, pag naka-adjust na yung bowel mo, you will expect the stool in your sigmoidostomy to be solid to formed stool. Ganun lang yan. And lastly, number 5 for your stoma facts. With regards to odor. Pag may ileostomy ka, guys, you don't expect odor problems here. Why? Because in an ileostomy, since it's still part of your small intestine, there's lesser bacteria. Lesser bacteria means lesser odor problems. But once you have a colostomy, ascending, transverse, descending, or your sigmoid colostomies, this is where you will expect problems with regards to odor since your large intestine is known to have more bacteria. So, in a colostomy ka lang, nagkakaroon ng mga regulations in terms of the food that you eat that can cause odor. Next, let's talk about stoma irrigation naman. Guys, if you have an ileostomy, please take note, you don't do any stoma irrigation. Because if you irrigate an ileostomy, the patient will suffer electrolyte and fluid imbalances. You only do stoma irrigation when the patient has colostomy, pag nasa large intestine ang stoma niya. And what's really the purpose of stoma irrigation? Number one, it's to release stool or fecal matter and gas. And number two, it's to establish bowel habits so that you can regulate bowel control. Question, when do you do stoma irrigation? You do this 4 to 5 days post-operatively. When is the best time to irrigate a stoma? The answer is when the patient would normally have a bowel movement. So, when do we usually have a bowel movement? In the morning, after breakfast, or after a meal. And the reason is because we want to take advantage of the movement of the large intestine or the peristaltic movement that will help us during irrigation to expel fecal matter and to expel gas. So how do we do stoma irrigation? Una, paupuin mo ang patient sa bathroom commode or sa toilet para bang tatae lang din siya gamit ang anus niya. And then, meron tayong irrigation bag na pinupuno natin ng irrigating solution. 500 to 1,000 ml ang irrigating solution na ginagamit natin sa stoma irrigation. Now, when you're asked, what kind of fluid do we use as an irrigating solution in a stoma? The best answer is tap water. Tap water lang. Hindi tayo gumagamit ng plain normal saline solution or any special fluid. And it's because your colon, your large intestine, it's not a sterile field. Remember when I said marami tayong bacteria dyan kaya tayo may odor problems. So we don't use any special liquid. We only use tap water to cleanse your colon. And remember guys, when you're using tap water, make sure it's not cold because cold can stimulate peristaltic movement and peristaltic movement can cause cramping on the patient and discomfort. So dapat when you use tap water as an irrigating solution, make sure you warm the solution in body temperature to prevent cramping, to prevent discomfort. And then, anong gagawin natin? We will hang the irrigation bag 18 to 20 inches above the stoma. Above the stoma. Not above the patient, not above the abdomen. Okay? Above the stoma, dapat it's 18 to 20 inches. And then, syempre, from the bag, we also have a tubing with clamp. And the clamp is used to regulate the flow of your irrigating solution from the irrigation bag. And then sa dulo ng tubing na yan, meron tayong plastic cone na pinapasok natin sa loob ng stoma mo para mapasok natin yung tubig doon. And the depth of insertion of that cone in the stoma should be 3 to 4 inches, not more than that or not less than that. And then we also place an irrigation sleeve. So, tatanggalin natin yung stoma bag or yung appliance from the stoma and then we attach an irrigation sleeve. Yung irrigation sleeve na yun, ang purpose niya is to prevent spillage of the fecal matter to the patient. Para i-direct mo yung mga outflow niya from the stoma to the toilet or to the bathroom commode. And then we start irrigating na. We will instill the prescribed fluid 500 to 1,000 ml within 45 minutes to 1 hour. During this time, cramping may occur. And what are the potential causes of cramping? Number one, if you are using a cold irrigating solution. Kaya dapat body temperature yan siya or lukewarm water. Or number two, if masyadong mabilis ang pag-instill mo ng irrigating solution in the stoma. So what's the management when the patient starts to complain of cramping? You simply stop the instillation of your irrigating solution. And then you wait until cramping subsides. Once the cramping subsides, that's the time you reinstill the irrigating solution but on a slower pace or on a slower rate. Okay? So stop, wait until cramping subsides, and then irrigate again on a slower pace or slower rate. So, what are we expecting? We are expecting the passage of fecal matter and as well as your gas. And the things that are reportable to the physician when you're doing irrigation is number one, if may changes sa color ng stoma mo. If the stoma starts to appear dusky blue or purplish or black, report yan sa physician because that means nagkaroon ng problem in terms of the circulation of the stoma. Remember when I said the normal color of the stoma must be brick red or fleshy pink or reddish or meaty red, okay? And secondly, it's also reportable to the physician once you cannot insert the plastic cone in the stoma. Meaning sumikip yung pasukan ng cone, it might probably indicate there's an obstruction. So, reportable din yan sa physician. Next, let's talk about the dietary changes when you already have a colostomy or ileostomy. You must instruct the patient na small frequent feedings na lang siya, guys. That is to allow the bowel to adjust to the surgically made stoma. So, small frequent feedings or 6 small meals in one day. And of course, we should increase hydration to prevent dehydration. And then we have to note different types of food that may cause odor. So yung mga known odor-forming foods natin are your cruciferous vegetables or yung part ng cabbage family. So, cabbage, broccoli, Brussels sprouts, kale, cauliflower, they cause odor. Mga beans, cheese, beer, or alcoholic drinks, garlic, asparagus, and even eggs. So, ano ba yung mga foods that you can eat to minimize odor? Number one is parsley, cilantro, mint. You can also take chlorophyll tablets in order to deodorize your colon. And you can also take bismuth subcarbonate to deodorize your intestines. And in some stoma appliance, they have charcoal filters where you can input charcoal tablets in ostomy pouches to reduce odor. Next, what are the foods that can increase the risk of obstruction or blockage in your newly created stoma? Diyan na papasok yung mga insoluble fibers like your grains, corns, popcorns, nuts, seeds, kernels, celery, and even coconut. Next, the patient should also reduce or limit mga gas-forming foods. And as a nurse, you have to ask the patient, ano ba yung mga kinakain niya before surgery that causes gas on the end of the patient. So this one, based on patient experience, iwasan niyo yung mga nagkakos ng gas sa kanya. Ano pa yung mga gas forming pag may stomach ka na? Inhaled air. So, instruct the patient to avoid drinking through a straw, avoid chewing gums, and avoid sucking on candies kasi this will allow for ingested air and then yun yung magpo-form ng gas sa stoma mo. So, paano ba natin minamanage ang gas in a stoma appliance? Simply burp the bag. So, how do you burp your bag or your appliance? You just open it and then release the gas and then close it again. You must also instruct the patient to avoid punching small holes on their stoma bag or appliance kasi this can destroy the odor-proof environment of that particular appliance. The next is about patient care. Guys, you have to note that every time a patient will lose a part of them via surgical procedure, amputations, in this case, intestine, nagkaroon na sila ng stoma, the patient will really undergo grief and the 5 stages of grief. So, denial, anger, bargaining, depression, and then finally, acceptance. So, mag-undergo talaga sila ng dabda. And as a nurse, when you are caring for a patient with a newly made colostomy, you have to note that this is normal and expected. And as a nurse, what you can do is to offer a supportive environment for your patient and to allow them to verbalize their feelings. And then lastly, ano ba yung mga positive adaptations that we are looking for a patient transitioning to a life with a stoma? Ang pinaka-first and initial Positive adaptation is once the patient starts to show signs of acceptance to the stoma or colostomy or ileostomy, and it is manifested once the patient starts to look at their stoma. That's the best initial. Now, ano naman yung pinaka-best na positive adaptation? The best positive response is when the patient starts to assume care of that particular stoma. Once they get involved in their stomach care, once they start irrigating their stoma on their own, once they start putting their appliance on their own, these actions will show you attempts from the patient's end to assume care for themselves. And as nurses, it's very important that we promote patient independence because patient independence can improve their self esteem. That's all for your stomach care, and I hope you learned. Bye.